I'm Elizabeth Wicki and I'm a registered nurse. I'm going to be going through medication administration. Before administering, you're going to want to make sure you do the 6 rights. And the 6 rights are right person, right medication, right dose, right time, right route, and right documentation. Triple check the MAR and include the person in the medication administration process. During administration, you're going to want to wash your hands and put gloves on. People should have privacy during the medication administration process, and you can administer medications 1 hour prior or 1 hour after the dose is scheduled. Each person we support in medication administration either has a paper MAR or a MAR on Google Drive. With the paper MAR, you will want to sign the signature page and write your initials on the MAR. With the electronic MAR, you must type your name at the bottom of the MAR and place your initials next to the typed name. If there are any problems during medication administration, circle or highlight in red your initials and explain in the nurse's notes section. If you touch or drop a medication, the medication is considered contaminated. Use gloves and put the medication into a plastic bag and label the outside of the bag with the date and time and the contamination, the name and milligram of the medication, and with a disclaimer saying the medication needs to be destroyed. Lock the bagged medication in the locked medication area, and if the medication is a controlled substance, double lock the medication. Contact your QES and explain that there's a medication that needs to be destroyed, and follow the instructions from the QES regarding finishing medication administration. Starting a medication. Looking at the slide, when writing in a medication, you must include the generic name of the medication, the correct dosage, and the number of pills, the correct number of times the medication must be administered, and the date the medication was ordered. Discontinuing a medication. While looking at the slide, the DSP is responsible for discontinuing a medication. Follow the protocol on the right for both paper and electronic MARs. Inform QES that there are discontinued medications in the home that need to be removed. Documenting a refusal. To document a refusal, you will want to put an R on the MAR and explain in the nurse's notes the situation. Contact your QES and fill out an internal incident report. PRN medications, or as needed medications. The PRN policy includes a doctor's order for a PRN must be present in order to administer and written on the MAR. You may not administer any of your own personal over-the-counter or prescription medications to the person. This medication must belong to the person. Follow the protocol when you give behavioral PRN medications. Documenting an issue. If a medication is omitted or not given, you must put an O in the correct box, highlight the box in red, and explain in detail the issue that occurred in the nurse's notes section. If there is an issue during or after medication administration, you must highlight the cell in red and explain the issue in the nurse's notes section. Medication errors. Wrong medication, wrong dose, wrong person, wrong route, wrong time, and wrong documentation. The policy includes within a year the DSP cannot exceed 3 errors without disciplinary action. The following disciplinary procedure will be used to ensure that medication errors are not repeated and necessary training has been completed to prevent future incidents. The first, second, and third medication error, the QES or DQE will talk about prevention through a positive coaching session. The fourth medication error, the DSP will receive a corrective action with mandatory medication administration retraining listed as an action item. In the fifth medication error, the QES and DQE will determine an appropriate disciplinary action for the DSP up to and including termination. Reporting guidelines: contact the QES to inform them of error immediately upon discovery. Contact the physician or pharmacy to determine any immediate health and safety risks to the person. Follow their instructions. And fill out an internal incident report about the error. Always report errors, regardless of whether you committed the error or whether the error was discovered. Some abbreviations that might be common on medications that you will see: BID means 2 times a day. HS is at bedtime. PO, by mouth or oral. PRN, as needed. And TID means 3 times a day. If you have any other questions, please contact or review these slides. Now I'm going to be demonstrating how to properly administer medications. I've already washed my hands, and now I'm going to apply my gloves. All right, first I'm going to gather all the medications that I need, and next I'm going to check each medication with the MAR. So first I have the green Skittles, and it says take 1 tablet by mouth twice daily. Those are green Skittles, 500 micrograms, and I see that right here. Next I have take 1 tablet by mouth daily, purple Skittles, extended release, 25 milligrams, and I see that right here. Next I have take 2 tablets by mouth once daily, orange Skittles, 100 milligram, and I see that right here. So next I'm going to want to do a second check. And to do that second check, I take the medication and I check the label and the bottle against the MAR, and I have that right here. Then I take 1 out and I set that aside. Then I check the next label, take 1 tablet by mouth daily, purple Skittle, extended release, 25 milligrams, right here. And I set that aside. Next I have orange Skittles, take 2 tablets by mouth once daily, 100 milligrams, and I see that right here. So once you have completed those 2 checks, you'll want to make sure the person you are supporting is near, and you're going to go through each one of those medications with them. Jane, I have your medications, and I'm going to go through each one of those with you. The purple Skittle is for your high blood pressure. The green Skittle is for your depression. And the orange Skittles are so you can taste the rainbow. And that's how you properly administer medications.